It's your girl, Love to Smile Aaron, and today comes another episode of Beginning with Jesus. We learn and we end with a motivation. Alright, so our main text for the day is John 11:24, which says, "Therefore I say unto you, whatever you pray and ask for, believe that you receive it, and it will be so for you." Now let's zoom into our health topic for today, which is understanding hypertension, its preventive measures and management. One may ask, what is hypertension? Hypertension is normally what we call high blood pressure. How does it come about? It is a medical condition whereby the force of blood exerted on the artery walls is consistently high. In this case, it can lead to damage of the blood vessels, the heart, and other vital organs. What is the cause? The main cause of this is unknown. However, there are risk factors that contribute to one having this condition. Advanced aging, having a family history of hypertension, stress, poor diet, obesity, excessive alcohol consumption, smoking, and to name a few. Okay, so the signs and symptoms of hypertension include: hypertension is a silent killer. So one can have this condition for a number of years without exhibiting any symptoms. But in severe cases, which is called asymptomatic, meaning they do not exhibit any symptoms. But in severe cases, this client can exhibit shortness of breath, which is difficulty in breathing, blurry vision, and then headache. Now let's come to the dietary management. What are some of the foods or healthy lifestyle we can inculcate or adopt to help manage this condition? Having a balanced diet, including lots of fruits, vegetables, whole grain, green leafy, lean protein, and then low fat dairy. Now let's talk about the lean protein and then low fat dairy. Examples of each. When we talk about lean protein, we have fish, salmon, we have eggs, we have legumes, nuts and seeds, chicken breast, turkey breast, lean beef, shrimps. Now examples of low fat dairy include milk, cottage cheese, and then Greek yogurt. Now all these foods mentioned above or earlier on are less in fat, low sugars, and then low salt. We should consider baking this food, grilling, and then poaching them instead of frying. Try as much as possible to trim off excess fat from meat. Now you also have to increase your potassium diet. Examples of these foods include sweet potatoes, green leafy, and banana. Now we have exercising too as a healthy lifestyle. As much as you can, involving yourself in cardio exercises, stretching can also help manage hypertension. Adopting stress management techniques like yoga, deep breathing exercises, meditation can also help reduce your chances of having hypertension. Ideally, it is recommended that having 7 to 8 hours sleep a day can help manage your stress and in turn reduce your chances of having hypertension. So weight management is also a key factor. That's a combination of healthy dieting and exercising can go a long way to reduce your chances of having hypertension. Now, alright, so how do we diagnose hypertension? Now, a repetitive and careful monitoring of the blood pressure for a period of time, what we call the BP profile, it serves as a diagnostic tool. Now, the preventive measures and treatment option we can put in place to help manage hypertension include maintaining a healthy lifestyle, getting enough rest, that is at least 7 to 8 hours sleep a day, limiting alcohol consumption, smoking. Now, smoking has a way of affecting most of our vital organs, so it is advisable that one has to stop smoking. Also, adhering to prescribed medication by your healthcare providers. Work with your healthcare provider, sticking to review date appointments with your healthcare providers to help manage this condition. Alright, so amidst everything being said, some of the complications that could arise include heart failure, stroke, kidney disease, eye damage. Now, the eye damage When the pressure in the retina increases, it leads to vision loss or blindness. You can also have a cognitive impairment. Before we wrap up today's episode, let's briefly discuss the BP values. Now, BPs are normally recorded in two folds, the upper pressure and the lower pressure. The upper pressure, which is the systolic, is the contraction of the ventricles. Now, the lower pressure, which is the diastolic, is the relaxation of the ventricles. The normal BP range is between 100 to 120 systolic, and then 65 to 80 diastolic. Now, when one is diagnosed of having hypertension, the BP rises from 130 to 160 and above, the systolic, and then the diastolic happens to be 80 or 81 to 90 and above. So, take note, before one can be diagnosed, there has to be a careful and repetitive monitoring of the BP. Alright, so check the page for a more detailed chat on the BP values. Thank you and bye-bye. See you in the next episode.